Hello, and welcome to COVID-19 Now What, a new weekly video series from the Easthampton Health Department. This is Amy Hart, the public health nurse for the city, and today is Friday, March 19th, 2021. Today, I'm going to begin by pulling up the data dashboard that was just posted to the city website as well as our Facebook pages today. Bear with me one moment while I pull that up for you. And I'm going to answer some questions that people may have as they look at that image. So here we go. Why don't we start with the top row, which as you can see is all yellow for this week. So one question folks may have, if they look at the far left and right corners, which are the 14-day daily average and test positivity rate. Now these numbers come directly from the state, which posts them every Thursday evening. Those numbers we see are an increase, which happens to be slight, by the way, over the previous period. And you may wonder, how is it that those numbers have gone up while in the center you see our 7-day numbers have gone down? Well, in a nutshell, last week we did have slightly fewer cases than the previous week, which is why the 7-day numbers are decreasing. And on last week's dashboard, you may recall that we were in the green zone for the 14-day numbers, but in reality, we were just barely over the line. We were almost in the yellow zone already. So right after that 14-day period, there was a slight rise in cases one week, followed by a slight fall the next week. Now, keep in mind that with Easthampton's population of around 16,000 residents, we are only talking about a difference of a couple weekly cases here. The main point I want to make is that we seem to have leveled off around the yellow risk zone, which is, of course, better than we were over the holidays or after the holidays, but it's not where we want to stay. Next week in this video, I will explain in detail why this matters so much when I talk about variants of concern. Now, on the positive side, as you see in the lower right blue box, vaccine distribution continues to grow. The cumulative total percentage for Easthampton and Westhampton residents in our zip code is 27.5 now, either partially or fully vaccinated. If you haven't heard, starting March 22nd, a new group is eligible for the vaccine, including those 60 years old and up, retail and food service workers, and more. Please check out the mass.gov site to see which phase you are in and how to pre-register online for your appointment. Next, I want to highlight the center graph. This is something I switch out each week to highlight particular ways the pandemic is playing out locally. Here we can see that since the beginning of this year, the majority of cases have been aged 20 to 60, with the largest group being the 20-somethings by a small margin. This is no surprise, since people aged 20 to 60 are more likely to be in the workforce, to get together with friends, or have children or young adults at home who might be exposed to their peers more regularly. In general, people in this group may also be less concerned about the danger of acute illness with COVID, since they are typically not at high risk, and their personal behaviors may reflect this. However, everyone needs to keep in mind that long-haul COVID symptoms are real. And they can show up for people who have never even had symptoms while they were infected with COVID. We have a lot more to learn about this particular disease outcome, including how serious it may turn out to be across the lifespan. We do know that commonly reported long-haul symptoms are difficulty concentrating, headache, fatigue, body aches, shortness of breath, and more. If you are experiencing symptoms like this beyond your recovery period, please contact your doctor to get care. Also, if you are someone who works outside the home and you are not sure what your company's HR policy is currently for COVID-related time off, whether it be for you as the one who's sick or because you were exposed to someone else, please find out about this policy before you need to use it. It's very possible that the paid time off that was available to you last year will not look the same this year, as federal laws have changed. And keep in mind that if you do need to stay home from work, there are programs to help with food and rent if needed. Call us at the City Health Department or tell the contact tracer when they call, and we will do our best to connect you with those resources. On a final note, the lower left and right purple boxes are cumulative totals for Easthampton since the beginning of the pandemic. And I want to just note that the lower right corner of total lives lost, this number gets updated as it is backfilled. So there's typically a lag of a month or more in this being updated for a previous death. Now, I also want to highlight that the left blue box, current active cases, it reflects the number of people that we know to be currently in their infectious period in Easthampton. And I want to point out that researchers do estimate that actual infections are likely to be several orders of magnitude greater than reported numbers, because many people never get tested, whether they are symptomatic or not. Okay, so that's the dashboard. I'll take it down now so I can share what I've been hearing from local residents as I make the contact tracing calls when new cases are reported. It's clear that COVID continues to spread very efficiently within households after being brought in by family members who have maybe socialized with others, traveled, or not always worn their mask and practiced social distancing while they're around people not in their household. So if you do have new symptoms, your first priority should be to stay home, get tested, and isolate yourself from other family members by sleeping in a separate room and avoiding common areas in the home while you are infectious. Everyone in the household is advised to avoid going to work, school, or social gatherings until your test result comes back. And anyone else in the home who shows new symptoms should isolate themselves too and get tested as soon as possible. Waiting to get tested leads to more people being exposed, and it also can add more time to your quarantine or isolation period. Test results seem to be coming back within a day or two lately, so the sooner you test, the sooner you'll know if you have COVID and can avoid spreading it to others. Another thing I'm hearing is that many people are still going to work with minor cold-like symptoms and attending activities while they have this slight sickness, rather than getting tested and staying home until they get their result. Please don't do this. What some people may not realize is that there have been far fewer cases of cold and flu this season, and it's still a bit early for allergies. So if you do have any new congestion, unexplained fatigue, headache, muscle aches, or diarrhea, consider that it might be COVID and contact your doctor or go get tested. If you wait a few days to test, by the time you get your result back, up to a week may have passed, and you will have potentially exposed a number of people. This is exactly how COVID continues to spread in the community. Make a plan ahead of time for how you would stay home if needed for a couple of weeks, and be ready to put that plan into action whenever you or any other family member starts feeling sick. An area where I still hear some confusion is what to do if someone has symptoms and their test comes back negative. They should continue to stay home and get retested a few days later. Remember, false negatives do occur at an average of 20% of the time due to various causes. Also remember that we are infectious before we even feel sick with COVID. So if you have symptoms or test positive, everyone who's been exposed to you from 2 days before your symptoms began or you took your test, they will all need to quarantine at home as well. They should wait 5 days after their last exposure to you to get tested to have a more accurate result. Assuming they are without symptoms and they receive a negative result, they should stay in quarantine until the total of 7 days has passed. This will give us enough time to catch about 95% of the cases. If an exposed person does start to feel sick themselves, they need to stay home, isolate from others in the household, and get retested if their first result was negative. So that's all I have for today. Remember, next week we'll be looking at the dashboard again for updates and talking about variants of concern. I want to thank you for watching. And if you have feedback or suggestions for a topic for me to cover next time, please reach out to the Easthampton Health Department. This is Amy Hart, public health nurse, and I look forward to speaking with you again next week. Stay well.